I'm really excited today to introduce you to the Victorian Clinical Trial Education Centre. We have our slogan, it's Beyond GCP, and we will talk about that, what do we mean by it, very shortly. So recently it has been identified, and probably many of you know that, that the need for high quality clinical trial is crucial for the Australian workforce, meeting the requirements for the National Clinical Trials Governance Framework and the growth of the clinical trial sector in Australia specifically. What we are working on, we are working on the pillar of the high quality, which is one of the most significant pillars in the governance framework, in addition to the integration in practice, consumer focus, and safety of the environment in relation of running clinical trials. So how to achieve high quality clinical trials? It is best achieved actually by establishing and retaining skilled and reliable workforce within the health service organizations and medical research institute. Our steering committee in the past year, we reviewed existing data from various gap analysis in the clinical trial sector within Australia, along with existing education offering in health service and academic settings. It was found that the most trial sites are challenged by different barriers, and those are one of them. So it's mainly an inconsistency in existing education offering for their staff, including variability in quality, accessibility, and most importantly, the cost. So this is where the solution comes with establishing Victorian Clinical Trial Education Centre within Victoria, and it is this year it is brought to you to South Australia by South Australia and Northern Territory Regional Clinical Trial Coordinating Centre and the Office for Research in Department for Health and Wellbeing in partnership with the Health Translation South Australia. So initially, the initiative was supported over the last year through our 3 translation centers in Victoria, MAC, Monash Partners, and Western Alliance, alongside other organizations, including PCCTU in Peter Mac, V-CTEC Alliance, MCRI, and Alfred. So the vision of V-CTEC, actually, it is not-for-profit, Australian-wide member-based education center, enabling all clinical trial professionals to access high-quality, world-class training at no cost. We believe that V-CTEC will advance the clinical trial education quality rapidly, meeting the needs of staff and sites into the future. Our long-term aim, which is hopefully it will be very soon in the near future, is to become recognized globally as a professional center providing accredited clinical trials education and training. And we appreciate the support of the health sector leaders and community for their ongoing input and valuable suggestions. So this is those are the clinical trials professionals that we are targeting for V-CTEC. As you can see, it's multidisciplinary professionals in the field. We will be offering opportunities for investigators or interested clinicians in clinical trials, all kinds of research staff involved in running trials operation, as well as the different supporting departments like pathology, radiology, or other departments of significant contribution like clinical trial pharmacist, as well as ethics and governance office. So this is our V-CTEC current structure in terms of our governance. We have 2 committees for V-CTEC. Our overseeing committee for our strategic planning ongoing is a steering committee, and we have also an education advisory committee that is informing all of our education pathway along the way through V-CTEC. And we have professionals and key opinion leaders across the different fields of running clinical trials. And the reporting ability will be through the Victorian Research Translation Centre's Collaborative Executive Committee. Since we've started our launch end of April this year, we have started to establish a bank of reviewers and subject matter experts. And now we have about 190 members from multiple trial disciplines. You are all welcome to join that bank of reviewers or subject matter experts if you think you have expertise in a specific area that it will assist in improving all of our developmental plans. So please, if you are interested to join, please contact us through our general email address through V-CTEC. And we welcome everyone and all trial expertise. So what is V-CTEC actually? This is an interactive live platform using a learning management system or an LMS. Our training and provided resources, they are actually based on and guided by a role-based competency framework. We have established so far a competency framework for research staff. There is one for investigators as well, and they are around 5 core areas: study management, interaction with participants, lab operations, regulatory management, as well as professional skills. And under those core areas, we have different competencies and abilities and set of abilities, and we have put that guided framework onto our LMS as well, onto V-CTEC, to guide all the organization on how they would like to track the progress of their employees in the future. So what are our offerings? I'll be showing you very shortly a live demonstration, but just to understand what V-CTEC offers, it's not just the GCP component that everyone needs to perform and to have evidence for, which is part of what we will be offering. But we also offer self-paced education, ongoing online courses and educational resources up to date. We offer problem-solving skills for the research staff at the different levels through GCP in action, real-life scenarios that I will show you very shortly. As well as we have always interactive platforms through different webinars and workshops with the audience, and we have them regularly throughout our platform. We also offer role progression through those role-based competency frameworks that we continue to develop, as well as different professional development opportunity for the professionals through establishing community networks for different groups, as well as we are providing different events, including our annual conference, which I will talk about very shortly. In addition to that, we are offering the career opportunities for people who would like to grow in their sector, in the health service sector, and that's all put onto V-CTEC so people can have a look what's my next move, and they can see what's available within the sector. In addition to that, we are able actually to provide site customized support services depending on the need for each site. So if they contact us through our general email address, if you have a new staff and you're not sure how can you orient them throughout using our educational resources, or what's the best way to utilize our competency frameworks, we're very happy to be contacted anytime, and we will provide that customized service to you and to your organization. We're also providing and offering you to tell us what would you like in the future, what is the gap at the moment within your organization, what's not offered on V-CTEC that you would like to be offered through needs and feedback that is ongoingly happening throughout the platform. So now I will take you to a live demo. So actually to access V-CTEC, all what you need to do is actually to access that URL, vctec.myopenlms.net. So once you go to that one, it will take you to that page. So that is the first public page for V-CTEC, and it is showing the different categories that we have in terms of our offerings. The first ones are the educational categories, and the second row, it's about the career growth and professional developments. It's telling you more about our vision, about our target audience, and also what's coming soon. And we have site news that are ongoingly up to date. If you register to V-CTEC, you will be automatically receiving our newsletters, which we are releasing very regularly now, and it will be telling you what are the different updates on V-CTEC. So you'll be always on top of the different news. Toward the bottom, you will have our contact details in terms of the help desk support office, as well as myself for any further information or needs. And also, this is where you can actually provide us ongoing feedback and learning needs. So if we click here, for example, so let's, before clicking onto that one, let me take you to the registration first. So if you haven't registered to V-CTEC, it will tell you here, if you don't have an account, click here to sign up. And this is where it will take you to a registration page, and you will be able to fill all the required fields, create your account. It will ask you to confirm through your email address. You need to go back to your email address that you have added and confirm the account to be able to be a user in the system. So for example, I have already created an account. So what I will be doing is just logging in, and I'll be using this one. And as I did, if you forget your password, you can just click here, forgotten your username or password. So it will take you to the home page of V-CTEC. And once you log in, there will appear a key access, V-CTEC at 2022. And this access key, it will change over time. So anytime you try to access any of the components of the V-CTEC and it's asking for a key, you need to go back to your first login page. And this is where you'll find it here up the top. This is where now you can access all the components, and you can see here the ongoing feedback and learning needs. It's here, as well as it's down the bottom as well. So this is how it will look like. You just answer the questions of our survey, and they are very simple questions. You just need to submit the questionnaire after that, and this is where we will be provided by your feedback and ongoing. So let me take you to our different components. The first one are the online courses that we offer. So we offer actually two pathways in course completion. We offer comprehensive course packages as well as individual courses. And it's up to you and to your organization to decide how would you like to proceed with those courses. I'll show you what the comprehensive course package look like, and we are still developing more comprehensive course packages, but currently we have two essential one for investigators, including associate investigators as well, and another one for the research support team. And what do we mean by the research support team? Those are research nurses, study coordinator, research coordinator, data management, project officer, project managers, clinical trial assistants. So anyone supporting the running of clinical trials operationally, they will be having that set of courses customized to their roles. So if, for example, I go to the trial essential for investigators, this is where it will take me to introducing you to what is the whole package is about, as well as expected time completion for the whole package, including the 5 courses. If I go, for example, for the first course, so this is where we have course 1, 2, 3, 4, 5, and then evaluation and completion certificate. This is where it will be, you'll be able to issue that one once you finish all the courses. If I go, for example, PI oversight and trial management, it tells you what's the expected time for completing that course. So you're planning ahead in terms of completing that one, and the related competency area for that one that you need to achieve as an investigator. It also tells you what the course will introduce you to. So you will need it will give you a quick overview of what it entails. It is about how to actually access the course. It is through a SCORM package. It's an interactive, self-paced SCORM package. It's followed by a quiz. So once you finish or complete that package, you'll be able to access that quiz. And once you hit 100% or 80%, depending on the setting, you will be able to be issued a certificate of completion from V-CTEC. So I'll show you how the course will look like. So this is where it will open in another window. So here it's taking me to another window to open the interactive course. And we are trying to have the same functionality existing across all of our courses. So if we start from the introduction. So as you can see here, it is telling you there are different resources linked to the course. There is also the menu section where it's all like the table of content. Sometimes some of the slides, they will include some notes. So this is where you can get them from here. And also glossary of terms where we haven't defined things in details. You can go back to the glossary of term anytime throughout the course. So if I start this one, for example, there is always course navigation instruction at the starting point. So it will help you actually to be able to see if you need to search something or where the glossary of term or the resource tabs and how to navigate through the different elements. There will be always objectives for the course so that you know what you need to achieve. And then you will continue on with the different sections of the course. So this is how it will look like, and it will end by the summary of the course and acknowledgement of who developed the course. So our course development is through different organizations. That's why it's a collaborative development process, and we acknowledge any organization who put the maximum effort or the majority of the effort in developing those content ongoing. So this one I can just close it down, and it will take me back to the actual course content with the different courses. So I'll show you something. If we go to the individual courses, those are just separate courses. They are not full packages. Just in case if you don't want to do the whole package and you just want to do a course on running clinical trial from start to finish. It tells you what it is included and also the target audience for this package, whether they are investigator or research support staff. And in the future, we are developing things to pharmacists and ethics committee. So there will be always different target audience for the different single individual course groups. If I go, for example, for this one, let's say running clinical trial from start to finish. So this is an example when it will ask you to use your access key. So this is the access key that I showed you at the starting point at your home page. This is the first time that it will show when you started at the beginning, but once you've accessed it, it will not ask you for it again. So you forgot the access key where it is, you go back to the home page and you will find it here up the top. So you just copy and paste and put it there, and this is where you can access the content. In addition to our online courses, we have different educational materials and resources. They are not quite courses by themselves, so there is no certificate required for them. They are more self-paced educational resources for you at any time point. So we have educational materials that have been shared by different organizations, like PowerPoint presentations, for example, that will benefit anyone in clinical trials. We have also recorded seminars. If there were any organization who've had great seminars who's been running in the past and they are sharing it with V-CTEC, you will find them there. We also offer different toolkits that might help you, for example, in your continuous operational work. So like the consumer involvement toolkit, the clinical trial toolkit. So We find all the toolkits that exist in the space and we provide them in one place for you instead of you keeping looking at them. And also the different useful links that any clinical trial professional would like to access. We are providing those useful links to you as well. And we keep adding onto them things regarding indemnity insurance, Australian immunization handbook, and so on. Recently, we have put the TGA GCP inspection program. So anything that is useful and up to date for the field, we will add it to the useful resources. The other element in our educational offering is the GCP in action scenario, and this is the one that is exciting me all the time. This is where it takes your employees and everyone to the next level of critical thinking in clinical trials. So this is a problem-solving skills that, unfortunately, we get dragged on day-to-day practice and tasks, and we forget about how actually do we reflect on what we are doing, including GCP. Yes, you've had your GCP training, but how can you actually perform that in real life scenarios that can be gray area? And many of you might actually reflect on that. Clinical trial is not black and white. You will need to think. It can be interpreted differently, but how can you do that? This is where we offer you actual real life scenarios from real organization, but without identifying that organization. And we open it for reflection. So this is the current scenarios that we have for the time being. It's still open for discussion. We tell you this is a scenario that happened. We don't tell you which organization. And then we open it for discussion. What are the issues that you would consider? Do you agree with the decision with ethics committee, for example, and what will you do if you were in such position? So it is putting yourself actually in the feet of the person who actually faced that issue and making you think and reflect on all of the regulatory guidelines and all of your training and educations that you have had to put it into practice. So we keep that as an open forum discussion, and we have different people who can, so if we select open the discussion, this is where you can see actually the past responses from other people. So you can have a look at the other people's responses and you can start replying as well yourself after that. So this is where you can hit reply, and this is where you can put your actual reflection. So we are highly encouraging that practice. If you are working in teams, for example, and you'd like it to be a collective team response, we have done that through, for example, Peter Mack in PCCTU. It was a collective team response instead of one person response. So it's up to you to utilize those ones as an ongoing professional development for your staff. And we find that this is what the different staff needs. It's not just the senior staff, but also it will be helping the novice staff to understand how they progress within their field by putting things into practice, but always reflecting and having that critical thinking in mind while they are doing their profession. So highly recommend that. And we always advertise if we are putting another new one, and if we have closed one, we will let you know, and you can have a look at what was the response from the site at that time point. In addition to that, we offer regular live webinars monthly. So our live webinars are planned the first Thursday of each month from 12:30 to 1:30 Melbourne, Sydney time. I'm not sure what the South Australian time will be, so you will need to adjust that, and we may highlight that this is the Melbourne, Sydney time at the point of when we advertise things. So we have monthly V-CTEC webinars, and this is where you can register through them, as well as seeing the past recordings. So if you go to that one, you will find all our past live webinars. We had our launch back in Victoria. We had another one about engaging with the aging and involving older adults in research. And we will be adding more in the future as well. We had another one for the pediatrics, clinical trials in pediatrics. So you will find the slides as well as the recording there. And when there is a new one, it will be added in this page, and there will be a registration open for you to attend as well. So in addition to the live webinars, we have also live workshops. Those are small group workshops, highly interactive ones. So they are very limited in attendance number. So for example, this one, I have to put the access key. It's my first time to access. Oh. Oh, okay. I need to copy and paste. Okay. So if you go back, going back to live workshops, so this is where all our planned different type of workshops, and we have one coming in December. This one is a site file workshop. So this is where you can actually access the registration through that link, and it tells you what this workshop will be containing and the time, level of expertise, the prerequisites, and what is required for the day. So for example, those kind of small workshops, they are with maximum attendance of 10 per workshop. And we will be in the future offering more kind of different workshops, but currently we have that one is in a highly demand. So it is called the site file workshop on navigating the site file. And those are the past one that we have done so far. But this is where we will be also offering different updates on site news and the newsletter to tell you what's the current workshops open through V-CTEC. The other elements that we have also are the career growth and professional development. So this is where the competency frameworks, you can access the one for research support staff, the research nurses and study coordinators framework. I will leave it to you to have a look at it. It's a very comprehensive document, but we describe what do we mean by that competency framework, how to utilize it, and it's up to you and your organization to look at it in terms of the career tracking of your different staff in your unit and assessing actually them annually. This is something that many staffs they have lacked in the past. And those competency framework, they are derived from different international ones. We've just customized them within the Australian requirements and needs, and they have been reviewed extensively by different key opinion leaders and stakeholders within the field early this year. Currently, we have one for study coordinator research nurse competency framework, but also we are having another one for investigator competency framework, which is already released by the NHMRC. So we've just added here for convenience. And we are currently revising one for clinical trial assistant role, and we will be putting it very soon. We have also established community networks, and this is a good venue for the different groups of professionals in the field to share knowledge between the different expertise, and they are here for you. So they are open forum. We have one for clinician and investigators. We have one for research support staff, another one for pharmacists, and another one for ethics and governance staff network. So here, for example, for trial pharmacist network, I'll show you what it has. So again, if you're asked for the key, it is in your home page. So here we had a discussion topic about exploring the needs for trial pharmacists in clinical trial in terms of training, education, and competency. And we have put that to the audience, and we've had different replies, and it is still open for discussion. So this is where you can see the reply from other pharmacists in terms of their needs, and you can add as well onto that if you are working in the space of trial pharmacy. Those kind of forums, you can create your own discussion point from the start, and you can actually ask anything to anyone. Doesn't have to be now in South Australia. You can now link to Victoria, so we can link now Victoria and South Australia and sharing the knowledge instead of working in our shells, which is unfortunately has been the practice in the past. But now we are trying to encourage the collaboration and extended knowledge across the different disciplines. And that's why those social forums and networks are already there in place for you on V-CTEC. So you don't have to create another one or to think of other ones. They are all there. And if there is one that you think, this one is not established in V-CTEC, let us know and we can establish one for a specific group. I'll leave the annual conference now, but also we have now career opportunities. So if anyone is looking at their next step, currently we have 2 opportunities in Victoria. If anyone from South Australia, from any organization, you have jobs that are coming on board, feel free to send them to us and we will be putting them for free for the health sector. So this is where more people will be looking at your jobs as well, and they can hit the next step. So this is how we have seen the users look at this one ongoing, and it looks like people like to progress with their career for professional development and career growth. And this is where we will be adding our coming annual conference, and this is one of our annual events that we will be holding. We will be having that in March 2023. So just stay tuned and maybe save the dates for the time being, and we will be advertising for that soon in our coming newsletter. So I think this is what I wanted to share with you in terms of the system. In addition to the conference next year, we have something happening tomorrow, actually, our first online symposium on emerging changes in trial practice. It's from 9 to 2 p.m., again, Melbourne and Sydney time. If you are keen to register, if you go to the first page on site news, this is where it will take you to the registration link. It is still open and it's happening tomorrow. So far, we have about 540 registrants for that one. So we are hoping that it will be a successful one, and the agenda as well will be provided on the site news. So you can have a look at the agenda, you can have a look at our speakers and panelists. And I'm sure that this will be, you will reflect at some point with all of the topics that we had, because it's all about what's happening in the space now in terms of the change. And I'm sure everyone can reflect on the last 2 years, how things has changed dramatically in clinical trials operation. So this is what we're trying to keep you always up to date and having those keynote speakers coming to you through V-CTEC. So if you'd like to contact us, if you'd like to be a part of our reviewers bank or ongoing development, or you'd like to share your valuable content through V-CTEC and have your organization acknowledged and the authors acknowledged as well, and we have IP will be protected, and we have different agreements in place to protect that and ensure everything is recognized throughout V-CTEC. Please contact us, contact myself as a director, or contact our general V-CTEC support email address. I'll just end with South Australia contact, Tamara and Jessica. So if you'd like anything related to the management of V-CTEC in South Australia, please don't hesitate to contact any one of them. They have been of a great support so far to bring V-CTEC to the South Australian users, and we're very pleased that you are on board.